So this has a double tray. It has some hooks in here that are important to you guys for looking through these when you're wrapping them, not to get punctured or ripped them. And also just for cleaning, etc. The way this, are you guys interested in how this actually works?
We are.
Okay. So this comes with a couple different things. So you've got an implant, say a knee implant that's in the knee right here. The surgeon wants to get it out. So what the surgeon's going to do is they're going to use some osteotomes, they're going to use some other things to loosen it up as much as they can. And then they're going to choose to use these blades that we were just talking about. Two different types of blades out of this set. One is like a hook, and the other one is more of a driver into the cement base. Or it could be a press fit knee as well. It doesn't really matter. Press fit just means non-cemented. So these go into these handles, and these handles then, with a mallet, probably either this mallet or a mallet that you guys have in your sets, the surgeon would just simply come into here and start loosening up the cement mantle all the way around the knee. They try to get as much as they can out, and they can also use the other type of instrument here, which is the hook. The hook is more used for the tibia base plate. The tibia base plate is on the bottom, and this is really good for the surgeon to come in behind to try to, it's a really tough area to get the cement mantle out, to get that knee loosened up. Because their goal really is to get it out as cleanly as they can without ripping apart all the bone that's left. They want as much bone as they can to be able to reconstruct that knee. Well, this also, the back, that little hammer I was talking about too, this hammer comes in handy too, because they can hammer it through that cement mantle. So when that's done, let's get this out of the way here. When that's done, essentially for the hips, or for the femur side, we have these vice grips, and the vice grips go around this. And the surgeon will do this a lot better than I will, hopefully. But loosen this up a bit. You guys, everybody uses these maybe in the garage or whatnot. They come down, they tighten them down, release a little bit, tighten a little bit more, and then it's locked onto this femoral component. From there, they have these adapters that go onto this. And again, this is attached to the patient right now. It's locked on solid. It's got a locking on there and everything for the extraction. They use this large strike plate. And the strike plate is pretty heavy. If you guys have looked at this or cleaned these or put these things away. So this comes on with one of these 3 bolts. And there's a wrench in here. It's a 11/16. There's a couple different sizes for different things, but essentially that now is ready to pull off that knee femoral component with what I call the Thor hammer, but it's just a large heavy mallet that the surgeon's able to hopefully back that up. So it's a great set. It's universal now. It's going coast to coast. A lot of other hospitals have found the value in this as well. I think it's a great tool for Strong here in Rochester for all of us too. Our family and our friends want to have the same kind of technology other places do. I think that works very well. The tibia really works just the same. I won't walk you through it. It goes on the same vice grip, and it gets backed out the same way. You guys have any questions on this set? Yes?
What's the number one complaint you get from SPD departments about cleaning?
On this particular set?
Yeah.
I don't. This particular set I do not. The things to look for from an STP, or excuse me, smear department, it would be the moving mechanisms. Moving mechanisms and making sure you're not going to get stuck on the sharps. And I guess you could potentially get bone in there, but I don't think that would happen. I think they would probably clean that out before it got to you guys. But I would pay attention to that from your side.
And then what about?
Yeah, I just brought this in from the outside, but there's more blades on the bottom. They simply they go together like this.
Oh, that's cool.
You can have another piece on the top of that. And then that basically, like we were doing before, around the femur, around the tibia, a hip stem. They could use these, I'll tell you a great use of these actually, and you probably will over time, are these cuffed blades. You have cement mantles around things. The surgeons really hate dealing with them. Well, here's a really rigid blade that actually comes in different diameters from 10 to I think 20 in diameters that can be driven down into the knee or the hip, however that might work. So to answer the question I just had, all of these blades are stocked locally right here.
Critical piece.
And who's responsible for reordering, and do you have to notify your supervisor when you're replacing the blades?
So